PCI, medicine is safe. The number of patients is only one. Based on my dispatch information, the nature of illness is shortness of breath. Immediately I am going to request an ALS ambulance, and at this moment I am not going to hold his spine. My general impression is that I have a male patient in his late 60s sitting in a napping bed, and he's trying to catch his breath. Hey sir, my name is Gabriela. I'm with the ambulance service. What's your name?
Haas.
The patient is responsive to painfulness, to verbal stimuli, but he's not able to talk. Sir, do you have, are you choking with something? Do you have chest pain? At this moment, the patient, she's complaining that, are you having breathing with, are you having problems with breathing? Yeah, so the chief complaint of the patient is that he's having breathing problems, and he's just, he's not alert, he's just responsive to verbally stimuli. And I'm going to treat immediately his life threat, that is the shortness of breath. And I'm going to do that through a oxygen, through a non-rebreathing mask at 15 liters per minute. And while I'm getting my oxygen hooked up, the wife shows up and tells me that 6 months ago this patient had the same episode of shortness of breath, and he ended up in the hospital being ventilated, and he was diagnosed with emphysema due to chronic sinusitis and vaping weed. Also, this moment that she told me that the doctor were clearly saying that the patient cannot take oxygen more than 2 liters per minute through a nasal cannula. And my answer to his wife is that she's partially correct, because some patients with COPD, they end up developing some tolerance to carbon dioxide. So instead of using carbon dioxide to trigger breathing, they use oxygen chemoreceptors. But in this situation, the patient seems to be that is carbon dioxide that is triggering his breathing. So I will continue with my treatment after I'm making sure that his airway is clear. Now I am going to take his breathing rate and circulations simultaneous for 1 minute. The patient's circulation rate pulse is 152 beats per minute regular, and his breathing is 36 breaths per minute, partially shallow. At this moment, and then after checking his temperature, he's warm, pink, and dry. So he's not showing any signs of shocks at the moment, but still the patient needs to be transported immediately as soon as the ALS ambulance arrives. Now that I am going to keep making sure that he doesn't go into shock, and I'm going to keep checking his breathing. Right now also I am going to try to get the history taking OPQRST and sample from his wife, because the patient cannot talk. The wife stated that the patient began having this shortness of breath suddenly. About the PQ, the provocation, quality, and radiation, I cannot ask his wife, because that is something subjective that only the patient can describe. Regarding the severity, sir, if you have been 10, the worst problem breathing you have ever had, between 1 and 10, can you tell me with your fingers which number of pain you are? So the patient states that he's 10. Now I'm going to ask his wife about the time when this began. And then the wife stated that that this problem began 25 minutes ago. I also asked for any signs of symptoms of weakness recently that the patient went through, and she said that nothing. He's been sleeping, he's been being very healthy lately, and for that reason he decided to take his oxygen off and go outside and play with the dogs. The wife stated that he has no allergies. About medication, he takes plenty of medications, including nebulizers, which at this moment I cannot help the patient because he is not conscious completely. And the past major illness are mostly just the emphysema and the chronic sinusitis. And then the last oral meal, the wife tell me that they both shared a large pizza like 4 hours ago. The events leading to this is that the patient, in a nice days like today, they decided to go out and play with the dogs outside with the yard. And then after an hour, he began having this sudden shortness of breath. Now, at this moment, I am going to continue with my secondary assessment, and as I am beginning with my secondary assessment, I noticed that the patient's lips are turning bluish, and he's using his accessories muscles to breathe. So I think he needs more ventilation. So I'm gonna switch from non-rebreather mask to back valve mask at the rate of 10 to 12 breaths per minute. And then I am going to immediately put it in the ambulance because ALS ambulance is already here. And then over there, I'm going to try to see if I can get more information and take his blood pressure. Now I am going to take his blood pressure. And his blood pressure is 110/52. Right now he's doing better. And also his radial pulse, I'm going to take his radial pulse again and his breathing rate. His radial pulse is getting better now. It is 122 beats per minute, and his breathing rate it is 28 breaths per minute. So it seems that the oxygen through the back valve mask is working. At this point, I don't think so. I need to take any more secondary assessments like neurological or cardiac or reproductive, because the patient seems to be clearly having in breathing event in here. So I am going to continue transporting the patient, and now I am going to give my report to the ambulance. And I will begin by saying that the patient, identifying my unit, and then I'm going to state my estimated time of arrival. Then I am going to say that the patient is a 63 years old male patient. His chief complaint is shortness of breathing, and his past medical, his pertinent is that present is that he was playing outside with the dogs, and all of a sudden after an hour he began having these breathing issues. His past major illness is just emphysema 6 months ago, and his chronic sinusitis, and he's not alert, he's just responsive to verbal stimuli. The treatment, my findings is that the patient is just having some issues, problems, perhaps COPD one more time, and the treatment is just through the back valve mask. He's getting better. His late vital signs are 100/52 is the blood pressure, and the pulse is 122 beats per minute, and his breathing is 28 breaths per minute. At this point, I'm just gonna ask medical orders if they have any other questions or orders for me. And I am done with this station.